Miko says, "Hi, Raphael. Thank you for reaching out to people with your informative podcast each week. I'd like to ask you a question. My apologies in advance if you already have covered and spoken about this subject. Adenomyosis. Miko, I have never spoken about this subject, so thank you for asking. So I'm 48 years old and my uterus wall is enlarged. Ultrasound says it's 950 millilitres in size and taking up my abdominal space, pushing my bladder and feels like causing pelvic tilting. I need to watch out for maintaining good circumstances so that my uterus tissue doesn't rot and making sure that my uterus doesn't press on the kidneys and damage them. Would you see benefits for me to take up Pilates with my condition, physically and also hormone balance-wise? If yes, do I need to see a special Pilates specialist or any practitioners could assist me with my stiff belly or join a class with pregnant ladies? Any advice would be much appreciated. Thanks for your time. Kind regards, Mickey." Mickey, what a great question, because I had no clue what adenomyosis was, and I had to go and look it up. And so it turns out that adenomyosis is kind of related to endometriosis. The endometrium is the inner lining of the uterus. So the uterus has 3 layers of muscle, and the endometrium is the inner lining of muscle of the uterus, and it's the inner lining of the uterus, and the middle layer, the muscular layer, is called the myometrium. And adenomyosis is where there are growths of inner uterine wall tissue within the myometrium. So there's like uterus lining growing within the muscle part of the uterus. And that's similar to endometriosis, where the endometrial tissue, the uterus lining tissue, grows outside the uterus in the abdominopelvic cavity. And so basically a bit of a Google Scholar search, Mickey, didn't uncover anything in relation to exercise and adenomyosis. There were plenty of studies on surgery and hormonal treatment, and I imagine you've looked at many of those options, but so hormonal treatments, and even they embolize so they basically inject little microscopic glass beads or plastic beads into the blood vessels that feed the tissues that are, the endometrial tissues that are growing inside the myometrium, and that can cut off the blood supply and cause them to shrink. So there are a bunch of surgical and hormonal treatments. I didn't find any exercise literature at all. And so, based on what I've read and my understanding of the physiology and anatomy of the area, I would say probably movement is going to be good. Now, whether it's going to do anything for your condition, I would be skeptical about that. I would think you're probably not going to improve your condition through exercise, but exercise has so many other benefits. So it's going to improve your general health, your mental health. It's going to, help you with weight maintenance and cardiovascular, disease prevention. It's going to help with cognitive function. There are so many benefits to exercise. You should absolutely be exercising. Pilates in particular, you should definitely do some form of strengthening and stretching. And if you like Pilates, do Pilates. Should you do that with somebody clinical? No, I think you should just go and do a regular class. And I think you should just maybe start with a beginner's class and, let the instructor know that you have this condition and that sometimes you get, discomfort and stiffness and pain. And, if you get a bit of pain, don't be alarmed. If the pain feels intolerable, I would say stop and ask for, hey, can I do a different version? Or just reduce the range of motion or the effort level, put on fewer springs or drop to your knees or something to make it easy enough so that the pain's tolerable. And yeah, so that would be my general advice. But like I said, that's kind of just based on my opinion and background understanding, which is not a good thing to base expert advice on. So I guess, I guess that's the best advice probably that's available in regard to exercise, because I don't think there's any literature on it. So I guess go do some exercise. And if in terms of treating the condition though, I don't see exercise as part of that picture, but there seem to be plenty of medical treatments available. I imagine you've already looked into those, but if not, go talk to your doctor. Hope that helps.